want to welcome Dr. Stephen Rogers, Director of Emergency Mental Health Services at Connecticut Children's Hospital. Thank you so much for coming in today. Not a pleasant topic to talk about, but something we need to talk about because these numbers also apply to Connecticut. Am I correct?
Absolutely, absolutely. So yeah, it's across the country we see actually over 40,000 people commit suicide every year. We see about 500,000 ED visits with suicide-related behaviors. And we estimate that over 1 million people actually attempt suicide every year, costing the U.S. somewhere between $10 and $50 billion. So it's a big issue. Here in Connecticut, and specifically with youth, we know that about 15% of kids every year think about killing themselves. About 8% of kids actually attempt suicide every year. And so these are big numbers.
Yeah.
And in fact, we've seen an increase this year. We've unfortunately seen 10 children kill themselves this year alone, which is up from last year's total of 8.
10 right here in Connecticut. It was just a week ago, there was a national story about, I think, a 12-year-old girl who took her own life, sadly, because of bullying, cyberbullying. Yeah. Is that a factor? Is that maybe, does that help explain the increase in numbers?
It's a complex question, but what we do know about bullying and suicide is that both the bully and the victim, in fact, anybody involved in bullying, has an increased risk of suicide.
Both sides?
Yep.
Why is that?
It's hard to say. We just know there's a relationship there, probably stressors. So kids having a tough time coping and having increased stress certainly contributes to that.
Any theories on social media helping to contribute to that as well?
Well, we know about 16% of kids report some type of cyberbullying. That includes things like email, texting, and other social media. So we do know it's a contributing factor for sure. Significant
numbers, and a lot of people, a lot of teens admitting they've either thought about suicide, some have attempted it. So the question, I think the most important question for any parents or family members concerned about a loved one, what advice do you have for parents?
And it's a tough one, but it comes down to just talking to our kids. I think the best thing we can do as parents is to talk to them. Make sure that they understand what bullying actually is and all the negative effects it has for everybody involved. Second, we need to set up and maintain open lines of communications with our kids. We need to actually talk to them about their mental health. And that means more than just saying, hey, how was school today? Or, you know, how much homework do you have? It's actually talking about mental health and some of the issues that they may be concerned with. We need to make sure our homes are safe places, so ensure that we're safely storing things like guns, medications, especially over-the-counter and prescription medications, to make sure our kids aren't at risk of suicide at home. And finally, you know, we need to check in with our kids a lot. And if they're struggling, we need to have them see their pediatrician or consider contacting emergency mobile psychiatric services here in Connecticut. It's a great service, and parents can just dial 211 to access that service.
Okay, and that's not easy to do because a lot of times, even teens in good mental health sometimes sort of withdraw from the parents. They're not always easy to talk to. I would imagine a teen child with some sort of mental health issue like depression, they might withdraw even further.
Correct. So if you feel like you're struggling, that's when you need to get help. And I think a lot of people need to seek help because, you know, as parents, I have a 15-year-old daughter, and communication can be a challenge at times. But the reality is that kids that feel more connected to their families and their schools are at less risk of suicide.
Okay, so parents, that's their job, right?
Yep.
Dr. Rogers, thank you so much for coming in and talking about this sobering topic today. And if you or somebody you love needs help, you can contact the National Suicide Prevention Lifeline. That number is 1-800-273-TALK, TALK, or as Dr. Rogers pointed out, you can also call 211.